With this, we're moving on to our next conversation, and for that, I would like to call upon Mr. Jaspal Singh Riyat, Director, Corporate Business Development and Strategy for Microsoft, to moderate, and I'll request Shri Vikram Pagaria, Joint Director, National Health Authority, to join us as well, to share the perspective on implementing Ayushman Bharat Digital Mission for better data accessibility for governance and research. Well, our chief guest also spoke on Ayushman Bharat, and I'm sure you all are looking forward to this fabulous conversation, as are we. Have a time limitation here. We have some amazing conversations to continue later on in the day. So keeping all of that in mind, if you do not get an opportunity to ask your questions, as I said, we have a networking area outside. Please make sure that you reach out to your panelists, your speakers, and put up your questions. They'll be more than happy to accommodate all the questions that they can. And with that, I think it's time I invite Mr. Jaspal Singh Riyat along with Shri Vikram Pagaria. Let's have a huge round of applause for these two. There's a thing, I don't know if you know it or not, but if you clap, it's very good for your heart. I'm sure some doctors have told you that, haven't they? Let's exercise that a little bit more. Thank you. Wonderful.
Good morning, everyone. Up today, especially when we saw like a lot of rain in the morning hours. Okay. So I think this is going to be a very important topic, ABDM, right? Whatever that we are discussing today. I think there is a huge momentum that's already in place through ABDM that is from NHS side. And whatever transformations that you have seen in a lot of other industries, including fintech, right? ABDM has got a big role to play. And we have got a very important guest today to talk about how the journey has been, what are the new initiatives NHA is building, right? For next couple of years to ensure that we are actually going to get into the next momentum of bringing healthcare industry into the same league where we have seen fintech, like where we are one of the leading country in the world now in driving to close to 12 billion transactions per month, right? So I got Vikram Pagaria. He's Joint Director in NHA, and he's currently responsible to drive the whole coordination effort that's required to build the ecosystems together, including driving the adoption of whatever NHA is actually building, plus the whole capacity building exercise. So, Mr. Vikram, while we talk about today's theme of the conversation, that whatever platform initiative that NHA is driving, connecting the whole ecosystems together, and the theme is that accessibility to drive innovations for research as well as building policies for the government. But before you go there, just can you briefly talk about how the 360 initiative of the government through NHA over last 3 years since it's being launched, right, is helping the ecosystem to drive the adoption, and what are the milestones that NHA has achieved till now?
Yeah, thank you, Jaspal. So the Ayushman Bharat Digital Mission was launched as a pilot in the 6 union territories of the country on 15th August 2020. And 1 year later, in September 2021, it was launched nationwide. So it is close to about 2 years that this mission is being running. We have launched we already have a publicly available dashboard where about 40 crore people have ABHA IDs, and around 200,000 facilities and 200,000 health professionals are on our HPR and HFR. We have about 110 players who have integrated their APIs with us, which comprise both the government programs like the CoWIN, PMJY, National Non-Communicable Disease Program, Nikshay Program, as well as various private players. For example, Practo and Pristine are there on the screen. They have also integrated with us. What this mission of Ayushman Bharat Digital Mission, the main mission is to create a national digital health ecosystem, is to and to promote interoperability. So one of the main use case that we want to implement using ABDM is that when a patient goes to a hospital and the doctor over there asks, can I see your past records? And if the patient says yes, then all the past record, all the longitudinal health records or all the medical records that are there, immediately they come on the screen of the doctor, and the patient is not required to carry that polythene or bag of records. That is the kind of thing that we are visualizing as of now. We have been able to do it in some pockets, but there is a long way to go. Yeah.
So looking into future now, like when you look at the ABDM's effort for next, say, 3 to 5 years, and when I recently read Niti Aayog's report that, okay, the effort is such a huge implications like on India's economy that close to $200 billion of economic value that India actually can generate in next 10 years through ABDM itself, the efficiencies that we can build. So what kind of targets NHA is keeping itself like for India in terms of building the robust HPRs, the healthcare professional registries, healthcare facility registries, right? And of course, like the ABHA adoptions, that 40 crore that we have seen now. Ideally, you would like to cover it for the complete population. That's one. And second is, I know that it's not an easy journey. And what are challenges that you actually foresee to reach to a specific targets the government has kept in its mind right now?
Yeah. Presently, in Ayushman Bharat Digital Mission, we are focusing on creating the building blocks. So whenever, if we imagine a building, first we need to have the bricks and the cement and the base work, the foundational work that is required for a digital health ecosystem which is interoperable. So our main motive has been to create this foundational, to create this building blocks, and our main focus is on how to populate these registries of healthcare professionals, how to populate this registry of healthcare facilities. In COVID time, there were a lot of requirement that of the number of healthcare professionals, the number of healthcare facilities, and India unfortunately did not have a very credible data. We had some data, but that was also not updated. So it was imagined that we should have a up-to-date data of healthcare facilities, which we call as the healthcare facility registry, and the healthcare professional registry, which is the HPR. For private sector, also we want to promote the use of these registries just in the way of, just in the same way like the KYC services are being used. So know your customer services through Aadhaar, you give your OTP and you are identified. Similarly, we are trying to promote the use of KYD, know your doctor, and KYF, know your facility, know your healthcare facility services. For example, Practo, it has to onboard a number of doctors. So various doctors would sign on Practo. How would Practo know that this doctor who is signing on me is a verified doctor or not? So what would Practo do is Practo would send an email to them saying that please send me your council form, please send me your MBBS degree, and some people, they may fudge those documents, and then and the second point is the process is entirely manual. What we are building in ABDM is these digital public goods which are for use for the entire country. So any private company which wants to say use our identification services for doctors or for a facility, we are trying to we have APIs which are open, and any company can utilize those doctors and say that, oh, this doctor is a real doctor or is a quack. Because for our doctors to be listed on the HPR, we do a detailed verification process. So right now our main focus is on how do we populate these registries and how do we do the first step of installing some software in our healthcare facilities. And we have been struggling in NHA to decide whether we should go to the mandate mode or through the incentives mode to make it to motivate the ecosystem to adopt on its own. Nobody has asked us to use UPI, right? We all use UPI because we know the advantage of it. Similarly, what we at NHA are shifting our focus, or we are more inclined towards providing incentives, providing motivation to the citizens as well as healthcare providers to use ABDM and ABDM related functionalities, rather than saying that all beds, all hospitals with more than 100 beds, they have to be digitized by such and such date. So we have also started a health incentive scheme, digital health incentive scheme we call it as, since January 2023, where we are providing 20 rupees to each hospital for making an interoperable digital record, and we are providing 5 rupees to each software company for making that record. So we are trying to create a strong value proposition in terms of ABDM.
So quickly coming back on the challenges, like
Yeah.
if you see over last 3 years, and even when you look at the statistics on the number side, right, it's mostly the public sector health facilities where we have seen the adoption, and private sector, I think, is still a long way to go. So what are the challenges that you see actually? Why the adoption has been slow, and how you are thinking that, okay, when you're building plan for next 3 to 5 years, whatever feedback that you are getting, because you are managing those relationships right now with almost all the entities, right?
Right.
You're trying to get through that.
Yeah. So private sector is very important for us. 70% of our healthcare is being delivered by the private sector. One of the main challenge that we face while interacting with the private sector is that it is not inclined towards NHA's motive of interoperability. Narayana Hridayalaya, Manipal Hospital, and Fortis Hospital, Max Hospital, Medanta Hospital, we had a series of conversations, but they say that NHA is about interoperability, and if we promote interoperability, then patient would never come back to the same hospital. The patient can go to any other hospital. So that value proposition for private hospitals, what we also find is that this is the main challenge that we think. It is good for the citizen, it is good for the government, because they would get an entire view of the aggregated and anonymized data. But for the private sector to be motivated to provide interoperable solutions to the citizens has been our main challenge.
So I think switching gears to the whole data accessibility point itself, right?
Yeah.
Once the data is ingested, data is available to patients, or you call it consumers, right? How actually you are trying to create demand cases, right? How you are trying to generate demand from customers. I think that's going to be one of your key unique selling point. If demand is also there, I think there is a big way that, okay, it starts from public sector, but there is going to be a cascading effect to the larger other industry ecosystem. So how you are trying to solve it?
So absolutely, I think that is a focus that NHA is starting to give in a very conscious and a very dedicated direction. So in October 2022, we launched something which is called as the Scan and Share OPD registration service. So when we go to these public hospitals, there is a lot of queue. And given that our country is very well versed with QR codes, what we started is a QR code which is put on these public hospitals, a separate counter or at various places where a patient can scan the QR code from any app. They can use from any app which is ABDM enabled. They can use the Arogya Setu app, they can use the ABHA app, they can use Paytm, they can use Eka Care, they can use Briefcase and various other apps. And they can scan the QR code. So what happens when they scan the QR code, my name, Vikram, Pagaria, my age, my mobile number, my address, all the demographic details that are already there on my health ID, it gets communicated to the HMIS, to the hospital software, and I get a token number 42. So when my token number 42 comes, I go to the doctor and say that, oh, I have a pain in my hand, and I would have to visit maybe an orthopedic or a general medicine, and then they would immediately write that and give it to the patient. So this token service that we have started has crossed about 50 lakhs, mostly in public hospitals. But this is one of the use case that we are thinking of a person who has an ABHA. If a person has an ABHA, how does that having an ABHA would help him or her? So all the pain points that are there. For example, why can't we have at the pharmacy you go and you scan your QR code and you are able to take out a medical record from your health locker and provide it to the pharmacist. Or when you are starting from your home, you can send your prescriptions to a pharmacy, or through an e-pharmacy you can send your prescription. So addressing those pain points and providing some benefit to the end users would help in creation of demand. And since the demand side would be there, then supply would come.
Okay. So I think you are trying to bring the learnings from the world of UPI, that scan the QR code, and that same is now going to be applicable for your healthcare needs, right? Especially reducing the waiting time in the OPD, right?
Yes.
So quickly, I think switching gears to the data accessibility point, I think one, of course, is leveraging the data once the ecosystem is robust enough. You want to leverage that for various type of research as well as for building your government healthcare plans, right, policies. But before that, there is a concern that it is around data privacy, security, data theft issues, right? And that's also one of the key blocking point, right, for industry. So what is, how NHA is actually trying to handle this? Because that's going to be something that need to be, closely looked into to build a confidence that, ecosystem is now ready to adopt it.
Yeah, I think one of the main features of ABDM is its focus towards data security and privacy. The National Digital Health Blueprint, it is a 72-pager document which is available on our website. I think it is really visionary because it provided an interoperable ecosystem in a manner which takes care of privacy and security. So our mission is mission's main feature is its federal architecture. So federal data architecture means that I go to Apollo Hospital, my report is with Apollo Hospital. It is not with the government. So, and the next day, suppose I go to AIMS Delhi, and the AIMS Delhi doctor says that, can I see your pharmacy, your lab report? And if I say yes, the record travels from that SRL laboratory to AIMS Delhi. So government is not storing any record, it is just facilitating the exchange. And this exchange also happens only when consent is given. So
okay.
These are some of the ways in which we are ensuring. We also have a health data management policy which we follow. We are increasingly in touch with the Ministry of Electronics and Information Technology, so that the this personal data protection bill, if it gets passed, it would be very convenient and it would be very would be very beneficial for the entire health ecosystem, as it would give clear-cut directions on data privacy.
Okay.
Yeah.
So on governance and research, right? So how government is actually thinking about to leverage this data?
Yeah. So to be very honest, till now we have about 28 crore health records which are linked to ABA.
Yes.
As I had mentioned that the government does not store these records, what we can do and what we imagine in our minds to do, because still as of now we have not gone ahead and have done anything about data as of now. So what we are thinking about is that we will provide free anonymizers and aggregators as free tools to the hospitals. So for example, Apollo Hospital, we will give an anonymizer. At the end of the day, they would send us the details of the number of, say, persons who came to Apollo hospitals, their age groups, the kind of diseases that they report. So if that data comes, then we will aggregate it all and show it on our on the map and
Dashboards,
using
right?
that system. Yeah.
Okay. So I think, we'll just take one more question, So on the engagement side, right, how you are looking at to engage the private sector here, especially like startups, the external research-based companies, right, the healthcare companies also who wants to leverage the data. One, of course, is like access by NHA to build its own plan, but there is a world outside, right? So how you're thinking to, build access to that, which is actually going to drive productivity and helps the ecosystem if the data access is there, right?
Yeah.
So how you're trying to engage the ecosystem here?
So as I mentioned, Jaspal, right now we have not been able to start any work on providing this data and making available this data access, because we do not have that data, frankly speaking. But this is one area which we have decided to focus on, and maybe in the future we will think about that. But for private sector as a whole, what we are trying to do is we are participating in conferences like these and taking their inputs as to how do we, if they have any inputs and if they have any suggestions, and how do we create more awareness about it, and if there are any suggestions as to how this can be improved. We are we have our eyes and windows open for suggestions. That is what I can say at the moment. Yeah.
All right, thank you.
Yeah.
So we are almost at the fag end, but I think we can still take max two questions. Yeah. So I think you can start. Yeah. One question.
Can we have a mic towards the gentleman, please?
Thank you for the session, Mr. Vikram. Myself, Dr. Adil. It's been 6 years in the health tech space as a physician, entrepreneur, and the product manager. I have a question. As you said, there's a challenge among the private hospitals that interoperability will lead to patients switching the hospitals. And you said that there are initiatives which you are trying to create a demand and then the supply will come. But the initiative like scan and share in public hospitals, how will it lead to supply in private hospitals?
Absolutely. It will not lead to it. It's mostly for the public sector. What we are thinking as of now, we are working with Tata 1mg and another company named eVital in the pharmacy space as to how do we address some pain points. What we know from them and also our prior experience is that the maximum time that takes that the delay occurs in dispensing the medicines is when the pharmacist gets the prescription and the time he or she takes to take out the medicine from their store and give back to us. So if we are working alongside the private sector to find out, is it possible that if I start from my home, I send the prescription to a nearby pharmacy, and so that the prescription is sent in real time, and when I reach the pharmacy store, the prescription, the medicines are available and I can pick it up. So thinking about how we can address those pain points, not in the public sector, in the entire healthcare chain, wherever there are pain points, can we address them? Another use case that we are thinking is, suppose you go to a hospital and the doctor writes a laboratory test also to you and writes some prescription, some medicines also to you. What you do is, when you come out in the lobby, there is a digital board or a physical board which has some QR codes for nearby facilities. So you send your, you scan the QR code, you send your prescription to the pharmacy, and you go and do your lab test. And after you go and do the lab test, you go to the pharmacy and your medicines are there. So we are studying the ecosystem closely, identifying which pain points can we address, and we are trying to create that demand in the ecosystem.
Fair enough. Thank you.
Okay. I think we have to, due to paucity of time, we have to end this session here itself. Mr. Vikram is actually going to be around. After this, you can take questions offline. A round of applause to Mr. Vikram, for sharing his insights, what is happening in NHA. Thank you so much.
Gentlemen, I'll request you to take a picture with us. Thank you, Mr. Riyat. Thank you, Mr. Pagaria.